COVID-19, or otherwise the coronavirus. These are the world's most mentioned terms in the recent past, synonymous with a strange and unpredictable bug that has paralyzed the universe, almost bringing it to a standstill. The disease continues to wreak havoc even as China, where it is said to originate from, and several other countries seem to recover. There remains to be uncertainties, speculations, and controversies, with no scientific evidence to back up the theories purporting that this disease is laboratory engineered, thus begging the question, what is the genesis of COVID-19?
Yes, but they did a retest of the initial positive one and it was still positive. Yeah, but if...
Dr. Loice Ombajo, who heads the infectious disease unit in Kenyatta National Hospital, is one of the lead doctors currently working to curb the spread of COVID-19 in Kenya.
My name is Dr. Loice Ombajo. I am a medical doctor. I teach at the University of Nairobi. I'm a senior lecturer in the Department of Medicine. I'm also an infectious disease specialist, a consultant at the Kenyatta National Hospital, where I head the infectious disease unit. Well, I joined the University of Nairobi for my undergraduate degree in medicine, after which I undertook internship at the Kijabe Hospital, then came back to the University of Nairobi for a master's in internal medicine. Graduating as a physician, I actually worked as a physician again at Kijabe Hospital for a few years, during which time, other than doing my clinical duties, I also took up some leadership roles. I was the director of medical education and also acted as medical director for a few months before I moved back to the university as a lecturer. Soon after moving back to the university, I started another course at the University of London and the London School of Hygiene and Tropical Medicine. So I finished with a Master of Science in infectious disease at the University of London, and also had a diploma in tropical medicine and hygiene from the London School of Hygiene and Tropical Medicine. Around those years, I also had to take clinical rotations in infectious disease at the University of Maryland in Baltimore, and several months on and off at the University of Texas medical branch in Galveston. And that was really towards the training in infectious disease. So then I've continued at the University of Nairobi, taken up a number of roles in the process, both at the university and at the Kenyatta National Hospital. So the way it works is the Kenyatta National Hospital is a teaching hospital for the University of Nairobi. So a lot of our work could be around those two institutions. So other than doing consultant work as a physician and infectious disease specialist, I have headed the infectious disease unit at KNH for a few years now. And that included, setting up and preparing for any emergencies, infectious disease emergencies that may come up, but also heading a few programs, one that we call antimicrobial stewardship, that really gives guidance on how to use antibiotics in the institution. In that process, I've supported a number of programs at the Ministry of Health, one of them being the membership in the National Antimicrobial Stewardship Committee, where I head the Committee on Antibiotic Use, and then also supporting the National HIV Program, what we call NASCOP, where we've done a lot of work around developing guidelines for HIV treatment in the country. So it has been a journey of, doing a lot of things in the process, a lot of teaching, both locally and internationally, engaging in, a lot of conferences, international conferences in country, but also international conferences elsewhere. It's been an interesting, long journey to get to this point. COVID-19 it's taken us all by surprise, just by the intensity and magnitude with which it's come. It's a virus, it's caused by what we call a coronavirus. So coronaviruses are a group of viruses that have been in existence for a long time. Even in humans, we've had some coronaviruses that cause things like the common cold. But some of these viruses also exist in animals. So it's known that sometimes a virus that's been in animals may change its genetic makeup a little And when that genetic makeup changes, it allows this virus to now be able to bind to human cells. And that's what we believe happened with this coronavirus. It's thought to have existed in animals previously, and now it seems to have changed its genetic makeup and is now binding to human cells, which means humans have never experienced this particular coronavirus. And when there's a new virus in the environment that humans haven't interacted with before, it means that we have absolutely no immunity to it. Usually what happens is that if you get a viral infection, your body sort of develops some chemicals that would allow you to fight the virus if you encounter it again. But this is new, so we have absolutely no immunity. That's why it's infecting so many people. And in terms of what it does to the body, is that it causes a respiratory infection primarily. So it would, bind to the cells that line the respiratory system. The respiratory system starts from, the nose, the throat, all the way to the lungs. So it will affect that lining and cause a pneumonia-like illness. A pneumonia being, infection of the lung tissue. So it would cause a pneumonia-like illness. But more and more, we're beginning to discover that it can affect other organs in the body. We know that some virus may be found in blood. Exactly what it does is not very clear. But with time, we're seeing that a lot of other organs in the body can be affected. So, for example, recently you may have heard in the news about this new syndrome that's being described in children, which is really a multi-system dysfunction affecting practically every system in the body. So this is a new virus, and we're still learning a lot of things around it. And I think as time goes on, we probably find newer things that it can possibly cause.